All right, this is the IOL Master. First off, we're going to uncover it. And then we'll
talk through it.
Oh, what?
I don't think you have to talk through
Oh,
it.
do I not? Okay. I'm happy to. You usually kind of help me remember anyway.
Oh, okay, that's fine. Whatever helps.
So then I'll put this in here. And you turn the machine on with this flashing blue light in here. Little power button right there. And hear it turn on. And I'm actually going to move this in a second, maybe. Then move it over to the right because we'll start with the right. Probably do that later. So that's the username, just Johnson. And then the password is 0000. So you can do it there, or you could use the touch screen here, go into the numbers. So I'll hit enter. And so it was last calibrated 5 days ago. And so since we're going to use it today, we'll perform the calibration test. I'll hit start. And if you go over here, you'll see that the little fake eye will pop out from that chin rest. There's the fake eye. So all you have to do is hit start. The machine will line that up for you. And so then to calibrate, you just follow the steps here. So it's just like the steps that you take when you actually take the IOL measurements. You will, where's the eye? There we go. You will start with this first step. You'll follow the directions with the arrows on there. I'll kind of tell you what to do. And so this says green, so I'm good to hit the button. So I'm going to hit the button there. And then for this one, you'll want to bring those yellow dots into the green squares, and it's telling me to move forward, so I'm going to move forward. Get a little bit down, move forward. Alright, so it's saying green, so I'll hit green, or hit the button here to take the image. And then for this last one, it's a little bit different. You just want to fill this with the lines, just like it says here, and you want it to be completely in focus. So you just move it along this axis until it's in focus. So that looks in focus to me, so I'll hit another button, and we pass the calibration test. Hit next, fake eye is going to lower down. And so now I can pull up a patient's information. I'd probably pull up a patient's information before bringing them into the room. So let's say this person has had some IOL measurements before. We'll look for their name and Tommy test. We will select for the exam. These will come up, and it looks like they had some measurements done on the 17th. So what we're going to do, we're going to go ahead and hit measure. IOL calculation you'd hit if you wanted to try to calculate an IOL using these existing measurements. Analyze you would hit if you wanted to, I suppose, change perhaps the target before you calculate the IOLs. So I'll hit measure. This will be for a new measurement. So it says OS right now, and we don't want that. We want to start with the right eye, so I'll move the machine over to the right eye. So now it says OD. And so now I'll get a patient to sit forward in the machine. Right. So we'll wipe off the forehead rest and the chin rest. And while this is happening, you'll explain to the patient these are the measurements we use in order to calculate the lens for cataract surgery. And once that's all wiped off, Mr. Test is here. And so it looks like it's a little low for him because he's having to bend down a lot. And yeah, we'll take glasses off. So I'll go ahead right here under the table and I'll lift up the table like that until it looks like it's a little better aligned. Then we'll say chin in there, forehead all the way against the bar. And what you want is you want the corner of the eye to be lined up with these measurements here. So I'll actually lift this up just a bit so that it looks a little more in line. And since I lifted that up, looks like her forehead's still pressed pretty well against the bar, and we're not getting a little error message here about forehead not being pressed enough to the bar. So we'll go ahead and start the test. So it's red, so we have to position it right, and I'll tell the patient blink, blink, blink. Just make sure everything's clear. During the actual image though, when you're trying to take an image, you won't want them to blink, so. All right, don't blink, don't blink. Blink, blink, blink a few times for me. And so I'll just bring this back a little bit since it's just saying to bring it back just a tad. And you can also put this on other. Don't blink, don't blink, don't blink, don't blink. Blink a few times for me. All right. You can hit it now because it's in green. Don't blink, don't blink, don't blink. All right. So we don't want to move that because we don't want to lose our measurements. You can have the patient stay sitting forward, or you can actually sit back in this case since it'll be a second. We're going to hit quality check just to make sure that we get all check marks for those measurements. Oh, and it looks like we have a yellow exclamation point there. So that measurement's not reliable. We'll have to take it again. It's good practice. So what we'll do is we'll hit measure again, I believe, for the right eye. Yep. So we'll have him sit forward, look straight ahead. Perfect. All right, don't blink, don't blink, don't blink. All right, blink a few times for me. All right. So I'll just move it a little bit forward. Let's see if I can get this a little better. There we go. Alright, don't blink, don't blink, don't blink, don't blink. Blink a few times. Alright. Keep looking forward for me. It's already green, so we'll just hit the button. And once again, we'll hit quality check. Ah, we still have that yellow.
I might be dry.
You might be dry. So we'll add some artificial tears. So let's put these artificial tears here. So here, I want to make sure the other ones are shaded. Okay. So I'll use some of these artificial tears that we have in this box. I'll check the expiration date. So these are expired. So I'll go get some new artificial tears. We can stop the video maybe, I don't know. Unless we want to make it a journey. Okay. All right.
I think it's not for now.
So we'll go over here and we'll go to the artificial tear drawer, which is here. Whole bunch of artificial tears here. I believe that these are the ones that we like to use, but these are already open. And are these expired? No, they expire in January of next month. So we'll use these, put them back. And we'll throw away those other ones that we found in the other room. All right. So these are all. So then we'll just break these vials apart. It's gonna be a little tough, but whew, there we go. in the box. So we'll leave these here in case anyone else needs them. Alright. So put the cap here. Remember, these are preservative free, so we'll throw these away at the end of the day in these vials. So look up to the ceiling for me. Use a tissue to pull back the patient's eyelid. I'm so sorry if this is gonna mess up your makeup. Eyes wide open. Did that get in?
Mm-hmm.
Okay. Alright, do you need a tissue? I should have given her a tissue beforehand. Alright. Eyes wide, wide open. You okay?
Mm-hmm.
When you rolled your head like that, I got scared.
Oh no, we're good. I hate eye drops.
Oh, I'm so sorry.
Oh, it's okay.
Alright. So then, once again, we'll hit measure again for the right eye. We'll have the patient sit forward, and we'll readjust this positioning here. Once again, we'll follow the directions on there. Don't blink, don't blink. Blink, blink, blink. Alright, and we'll move forward since that's what the machine is telling us to do. Oh, move too far forward. Got too excited. And we'll hit, oh, so that is not going to be good. This is a horrible tutorial video. Oh no. We'll see if it was good. Perhaps it was, but probably not. And it's good! So sometimes it all works out. You don't have to keep torturing Angela. So now, let me make sure. Yep, so now I'm gonna move this over to the left eye. Or no, I'm gonna hit measure again, and then I'm gonna move it over to the left eye. That's how you don't lose your data. So, no? What's wrong?
You're supposed to move it over and then click measure.
Let's see. Oh, the data's still there.
Okay, good.
Well, trial by fire. Alright. Blink a few times for me. Alright. Don't blink, don't blink. Blink, blink, blink. Keep looking forward. Alrighty. You can sit back. And we'll see if it all worked out. And it looks good. So because this has a little white no sign, that's actually okay. That means you can proceed. What we'll do is we'll hit IOL calculation and hit that button there. So now we see a few things here. First off, we have Barrett Suite, which we'll use most of the time. There's also SRK/T that we'll use. But for Barrett Suite, you see here we have the normal monofocal lens, Panoptix lens, Panoptix toric, and Vivity. So for all of these, if we ever need to change the refractive, actually, I think it's a refractive error or the refractive target, then it would be, normally it's 0.25, sometimes we might change it. So if you wanted to change it, you would just go here, 1, that's the only thing I've ever seen it change to, is that -1, and that will actually stay there for the next patient. So if you use it to calculate some IOLs, make sure you change it back to -0.25 before the next patient. So then, if that's the goal for this patient, we'll hit calculate. And this message will come up, but that's okay. Just hit okay. And these are your calculations. So it looks like she doesn't have enough astigmatism for a toric lens, which is why these lenses don't have any calculations there. But the Panoptix and normal monofocal do come up. It's completely fine if that doesn't come up. So then you'll just go down here, hit print, and you'll just click that button. And then I think you should be good. And then if you need to change that target reference back, you can just hit edit and then change it back right here to, let's see if I can add it. Wait, no, whoops. There we go.
Question.
That's it.
Why would we need to use something other than the Barrett suite?
Let's see. So I believe, and I could be wrong, that for the SRK/T, that's something that you would use. I honestly can't remember, but I think it's if a patient's already pseudophakic. Okay, so if a patient's already pseudophakic, then you would use the SRK/T for that patient. There we go.